Phase 1. Phase Day O hospital discharge. Goals: control pain and swelling, protect healing tissue, begin to restore range of motion ROM. O knee flexion at least 90 degrees. O knee extension less than or equal to 0 degrees. Establish lower extremity muscle activation. Restore independent functional mobility. Precautions: what weight-bearing status as tolerated, with crutches or walker unless otherwise ordered. Screen for sensory or motor deficits. Screen for DVT, symptomatic orthostatic hypotension, symptomatic low hem, active matic low hematocrit. Recommended exercises: range of motion, passive knee flexion and extension, heel slides, active assisted knee flexion or extension in sitting, ankle pumps. Strength: quad sets, glut sets, hamstring sets, straight leg raises SLR, emphasizing no lag, hip abduction or adduction, long arc quads lack, seated hip flexion. Functional mobility: bed mobility, transfer training, gait training on level surfaces, stair training, activities of daily living with adaptive equipment as needed, positioning when in bed, use a towel roll under ankle to promote knee extension, use a trochanter roll to maintain hip and neutral rotation and promote knee extension, never place anything under the operated knee, perform 10 repetitions of all exercises 3 to 5 times a day, use ice after exercising for 10 to 20 minutes. Inpatient plan of care: day of surgery, out of bed to a chair, PT evaluation, post-op day 1, PT and OT evaluations, therapeutic exercise including ROM, strengthening, and functional mobility as appropriate, ADL training as appropriate, post-op day to discharge, progression of therapeutic exercise and functional mobility, continued ADL training. Phase 2. Hospital discharge 6 weeks. Goals: continue to improve ROM with a goal of 0 to 110 degrees. Begin to restore muscle strength throughout the operated leg, with special focus on the quadriceps. Initiate proprioceptive training. Initiate endurance training. Recommended exercises: range of motion. Continue with all Phase 1 ROM exercises. Heel slide with towel. Prone knee flexion, heel prop towel under ankle and/or prone knee hang to promote full extension. Initiate stationary biking, starting with back and forth motion progressing to full revolutions as able, joint mobilizations and stretching. Initiate patellofemoral and tibiofemoral joint mobilizations as indicated. Initiate hamstring, gastroc or soleus, and quadriceps stretching, strengthening, quad sets, glut sets, hamstring sets. Proprioception, single leg stance, functional mobility, gait training with appropriate device emphasizing normal gait pattern, stair training with appropriate device, guidelines, perform 10 to 20 repetitions of all ROM, strengthening, and strengthening exercises 3x day, hold, stretches for 30 seconds and perform 2 to 3 repetitions of each, bike daily for 5 to 10 minutes if able. Phase 3. 6-12 weeks. Goals: maximize knee ROM, restore normal LE strength, especially normal quadriceps function, return to baseline functional activities. Precautions: avoid high-impact activities, avoid activities that require repeated pivoting or twisting. Recommended exercises: range of motion and flexibility. Continue ROM exercises from Phase 1 and 2. Continue biking, adding mild to moderate resistance as tolerated. Joint mobilizations. Continue with Phase 2 activities as indicated. Strengthening. Continue with Phase 2 exercises adding an increasing resistance as tolerated. Add resistance machines as appropriate including leg press, hamstring curl, and for way, hip machine. Emphasize eccentric control of quadriceps with closed chain exercises. Phase 4. 12 weeks and beyond. Goals: continue to improve strength to maximize functional outcomes. Return to appropriate recreational activities like golf, doubles tennis, cycling. Precautions: avoid high impact and contact sports. Avoid repetitive heavy lifting. Recommended exercises: ROM and flexibility. Continue daily ROM and stretching exercises. Strengthening. Continue with all strengthening exercises, increasing resistance and decreasing repetitions. Proprioception. Continue with all phase 3 exercises, increasing difficulty as tolerated. Guidelines: perform ROM and flexibility exercises daily. Perform strengthening and proprioception exercises 3-5x week, performing 2 to 3 sets of 10 to 15 repetitions. Continue endurance program 30 to 45 minutes 3x week.